death, in the simplest terms, is when your heart stops beating.
Okay.
So you feel a pulse here, or centrally up here, and if you don't feel a pulse, you have died.
Okay.
Which is what instigates doing chest compressions and CPR, trying to bring someone back. But when we go to check if someone has died, that's what the first thing we check is the pulse. But at the same time, they're not responsive. They've got a few other signs. Their eyes are dilated. But the main diagnosis of death is that they have no pulse. But when it comes to dying, I think that's a nuanced thing. I touched upon it earlier, but there's a lot of things that change in people when they are approaching the end of their life. So medically speaking, so like people just assume, I'll do a blood test, and that blood test will say, oh yes, someone's dying. It's not the case, as in, it's not as simple as that. Like, there are worrying blood tests that we look for. So we know when anyone's getting blood tests done, infection markers are really, really high, and then you're looking at the person, they're looking really unwell. So that sort of correlation between the really bad blood tests and the person looking really unwell, that almost suggests something is going on, that they're really, really unwell. And if that continues on for some time, they've got an infection, you're giving antibiotics, the blood tests are getting well, the kidney function is also getting worse, the liver function has gone off. It's showing that you're developing symptoms of multi-organ failure. So you're not responding to treatment that we have given so far. So that means what we're worried about, and so when I have these conversations, I'm worried that so-and-so is not responding to the treatment I'm giving. I'm worried that they may pass due to this. And so that's kind of what dying is in a sort of a very short period of time. But the death itself is when those moments happen.